sick with COVID. We have a bunch of our staff members come down. I have probably 2-3 dozen of patients in last week. So if you're hearing this, that is correct. Our DMV area is the highest in the country. About 15% of all of us are currently sick with COVID, which is 1 in 6 people roughly, maybe 1 in 7. So yeah, I find it pretty interesting that there is some news about it, but it's not so easy to find. Like if you just Google, current COVID statistics, you're not going to easily find the numbers. What this means is again, as I mentioned last week, a lot of COVID fatigue. I think people sort of fed up. So what am I observing? And we're going to talk about long COVID. When are we talking about long COVID, Janet? Not next week. A couple more weeks from now with Ashley.
Yeah, because Ashley needs to be here.
Right. So basically what the whole conversation is, will you get long COVID if you get sick right now? I mean, that's all comes down to that. Honestly, even I had 2 weeks ago or 3 weeks ago, I had my 101-year-old contract COVID, and a week later she was perfectly fine. So I don't think that I'm worried about people getting really sick. Interestingly, and I keep waiting until the COVID-related mortality gonna start going up, but it hasn't. So why that is not happening? I think it's simply because seemingly each subsequent variant seems to be less virulent, just more contagious. And again, that's coincides with a spike. So I'm not worried about you getting really sick. I'm worried about you getting long COVID. That's really what I'm worried about. With that in mind, I'm not going to discuss specifics of what to do. I would say try to prevent it as much as you can. Don't run to get a vaccine. Just if you think you're going to prevent it, you won't, because the current vaccine doesn't cover the strain much at all. You will not be protecting yourself from not getting infection. Maybe you will protecting against from getting really sick. But as I said, nobody's getting really sick. And while, yes, there is some data that vaccine can attenuate and decrease of long COVID, I don't think that that's worth getting the shot for it right now. So no new updates, except remember I said last week, if you travel, then yes, consider getting it. My point for that is simply because I don't want your travel plan get all screwed up. If you get a shot, there is a decent chance that your symptoms going to be milder and that you'll be able to push through them while on vacation. So that's that. All right, so that's news number 1. We'll do chocolate last. The news number 2 is a sort of really important news. They're not actually political, although you may feel them being political. So HHS just declared a week ago, and I didn't know that, but a friend of mine sent this to me, that they're broadening emergency declaration to facilitate responses to bird flu, other viruses with pandemic potential. So what does that mean? Well, in traditionally, there had to be a specific situation for the government to call something pandemic before a certain resources could be thrown at the problem. So this is a monumental change. That law was implemented in 2013, and it was a part of as emergency preparedness of the 2013 Act, whatever. Bottom line, HHS said, look, we're going to change that. And we're going to change that because it's we need to have a capacity to act on possible upcoming pandemics ahead of the pandemic. And so basically, they're declaring that going forward, if a government decides that there is an imminent threat of a pandemic, in this case, we're talking specifically about the current possible birds flu, that they will allow for the emergency use authorization for all kinds of things. What does it mean? Well, what it means is that, remember, when the COVID started, they pushed through the new vaccine extremely fast. They basically authorized them before even some of the data was back. So this is what's going to start happening. They're going to start utilizing FDA emergency authorization for things that may not even be on people's radar at all. So currently that particularly applies to the H5N1 bird flu strain, which to me, that's an interesting signal. I thought that this is nothing important. We're ignoring this, right? But remember, I promised to you I will track this closely. So I have been tracking it closely. So apparently government is more concerned about this than I am. And then, so maybe I should be more concerned about it. Maybe Will should be more concerned about it. But if they basically saying, look, we worried that H5N1 may potentially end up being a next pandemic, then they're going to start taking measures, emergency measures before it even had serious first cases of transmission. So I will put the link to that in a second into the, see, how do I do this? I got it because it's on my phone. I'll figure it out. I'll put the link to it. All right. So last, because I want to give Niall their time. So look at the link that Janet said, right? So this is the chocolate study. So in short, this is what Lee's study identified, basically saying, well, screwed. You like chocolate, you screwed. That's what the conclusion of the study. No, I'm just kidding. That's not the conclusion of the study. Conclusion of the study is, yeah, there
Stop
is
messing with people.
Well, I've been watching too many TikTok videos about airplane pilots messing with the people. Yeah, okay, I should stop doing that. So bottom line is, it looks like that most of the chocolate out there is having a pretty substantial levels of lead and cadmium. Now, those substantial levels need to be taken into sort of at the reference point. So most of the chocolate, surprisingly, would not pass California resolution, whatever that resolution is, where basically they say you have to have very minimum level of those contaminants, particularly lead. For the rest of the country, you know, it's still way below APA standard for those metals. It's not really clear at the sort of who's going to be at the true risk here. Why? Well, okay, so the cadmium is recently, in the last maybe 5 to 10 years, started showing up in a lot of our tests. And I kept breaking my head over it. I'm like, why is this happening? So it's possible that the cadmium in the chocolate is something relatively new, because this study didn't look 20 years back. This study looked at the data that's relatively fresh. So that's cadmium. The good news, cadmium seems to be, we're excreting cadmium a little bit better than the lead. And the amount of lead in the chocolate is relatively small. Of course, based on the study, you will see that the conclusion is simple. You know, eat things in moderation. If you're having a glass of wine and you want to have a whole chocolate bar, maybe you should have a half a glass of wine and one little piece of chocolate, because it'll be good for your health. Anyway, the whole idea that eating more chocolate somehow is going to be beneficial for you from antioxidant perspective, nah. You really need to be consuming pure cacao and not the chocolate. There's a sugar in the chocolate. So, you know, chocolate in itself is certainly a good food, but I would never advocate for eating a whole bar in one setting. So if you enjoy it in small amounts. Interestingly, you're going to have a question. Well, which brands are bad, right? I mean, well, they didn't answer that. They didn't want to answer that. Of course, you can imagine you say something particular about a particular brand, and then your head's going to go roll down because they're going to go after you with their entire legal department. It's fully understandable. The bigger issue is that's just they were not set up to do this in the first place. They didn't have that kind of data, because you have to be very consistent with analysis like this. And there's just, you know, so they basically just look at some overall data. They saw that there was a lot of, pretty much almost all the chocolate had some of the cadmium and lead. What I find very interesting, traditionally, there was earlier studies showing very high arsenic in some chocolate. They didn't find that at all. There was no arsenic in any of the samples that they analyzed. I find it very interesting. It's kind of contradictory to some of the prior studies. That could mean something. It could mean there may be some variability in some of the assessed samples. There may be some changes. And the final thing, which was really cool, is that the organic chocolate had more cadmium and lead, and good luck figuring that one out. Why that is the case? Well, because the idea is that organic chocolate is probably processed a lot less, right? So this is a more natural product. The cadmium and lead are probably just occurring in the ground, so it's just in earth. And it's unrelated to some particular treatments of the crops, right? So it's just that the cacao plant accumulates by growth, and you know, yeah. So basically, it means that if you were thinking you're protecting yourself from heavy metals, eating organic chocolate, bad news, right? So, I have a feeling there's going to be some follow-up. I'm wondering if Lee's going to try to get some grants to do some follow-up studies. I think, for example, it would be quite an important study to figure out not necessarily what in chocolate, but how does that translate to the levels in humans. So can we actually get an idea if you eat a lot of chocolate that your level of cadmium and lead will go up in the blood? And that would be an important study, but of course, that will take time. So I'll take my signal as getting myself off of the speaking channel, passing on to Niall. Niall, thanks so much for being back. It's a special treat to have you 2 weeks in a row. I hope you have something. Where's your cat? That's my
Yeah,
question.
she'll come as soon as she feels the
Come as
energy.
soon as she's ready, as soon as I call her. All right.
Thanks for having me back. I wish I wouldn't have been here for the chocolate one, but okay, fine. Take anything, just not our chocolate. We have so few good things left. Anyways, okay. Before we start, I see some of you are in transit, a lot of you are seated. I want to take a minute to prep our space. So before we start, I would like for everyone to get like a hand towel. So just a regular sized hand towel. Let me pull the screen back a little. All right, so about that big. And I'll show you how to use it. And then I'd also like if you can go into a room where there's a bed or some sort of place that you can lie down. If your body will allow for you to lie on the floor, you're welcome to lie on the floor. So with our practice today, we're going to start by standing. I'm going to guide everyone through some movement practices, and then we're going to be lying down. It's important for today's practice that we're actually lying down. It won't be as effective if you're sitting. So please take a moment to take care of yourselves. Go to a room where you have a surface where you can lie down. Take the camera with you. If you have headphones in and you want to just keep me in your ear and turn off your camera, you're welcome to do that as well. But for those of you who may not have worked with me before, I am very body based in the work that I do. It's a lot less about the mind. In fact, we try to clear the mind and take the mind out of it and really connect into the bodies, which means sometimes we've got to move. The towel, I'll show you how to use that in a moment. So go ahead and grab that towel and move to a room where you can lie down. If you can lie on the floor, then you can stay in the room you're in. We're not going to do any of that yet. I'm going to start by just talking for a moment. So the practice that I'm going to be guiding everyone through today is kind of a part 2 of what I talked about last week. Can you just raise your hand if you were here last week so I know who might have? Okay, yeah. So in the wellness talk last week, I introduced something called the Psyche Soma integration model. Do you remember that? Yeah, and if you weren't here last week, I invite you to go to YouTube and search the mindfulness experience and search for my name, and it will be the one from last week, whatever that date was. And I was the speaker for the whole time. So I talked a lot about this Psyche-Soma integration model and the need for an approach to addressing trauma that goes through the body, that allows the body to lead. And the reason this is so important in this day and age is because our bodies are craving connection. And there have been a lot of strategies that we have created, that our minds have created, that have allowed for us to kind of be pushed out of the body. Those are things like dissociation, distraction, mental chatter, depression, busyness. And so as time goes on, the more we kind of fall into those strategies, those become our survival mechanisms, and then they become us. And what happens is we become so disconnected from the body that the body starts to fall into organ dysfunction and system dysfunction. And by the time we're listening, it's too late. So I'm going to teach you a practice today that allows you to start to titrate back into the body, to quiet the mind and come into the body, to assess for an important place in the body. So that's going to be our practice today. We're going to assess for an important place in the body. Now, for some of us, we might find this practice a little frustrating. If you do, I want you to don't turn away from that feeling. Allow yourself to feel that feeling. Feel whatever arises. If it's frustration, if you feel some of those, the list of things that I described, the distraction, the mental chatter, the depression, whatever comes up, I want you to allow yourself to feel that. And over time, you'll start to feel that will fade, and what will be left is this beautiful body scan that I'm going to guide you through. So the purpose of this practice, the purpose of finding an important place in the body today, is for us to then be able to connect to this place. And that's where the towel is going to come in. So if you've gotten your towel, what I'm going to invite you to do is just fold it in half long ways. I don't want to cover my face again because the camera goes away. So you take the towel, fold it in half, long ends touching, and then fold it in half again, and then roll it up like a Tootsie Roll. And what we're going to do with this towel is once we assess for an important place in our body, and I like to use the word important because that's kind of it has the least subjectivity to it. It's a place that is asking for your attention without us putting a judgment around what that means. So once we find that place, then we're going to lie down on this towel. That's why I needed you to move to a place where you can lie down on the floor or on your bed on this towel. If it's in your back body, so if the place you locate is somewhere in your back, you're going to take the towel and just place it. Let's say it's like in the sacrum. You're going to place it there and lie down with the towel there. If it's someplace in your front body, I want you to just take your hands and you're going to place them there. Then I'm going to guide you through a practice from the Psyche Soma integration model that's going to allow you to connect your mind to that important place in the body, being open to the possibilities of a shift, which we can talk about at the end if we have some time. Okay, so that's what to expect. That's the practice. Are you ready to get started? Okay, let's have everybody stand. And you can just move your towel over to the flat surface that you're going to be lying down on later. And in this practice, because there are so many mechanisms in place that keep us from connecting to our bodies, I'm really going to be connecting with you virtually, energetically, to help guide you to an important place in the body. But with that said, can we try to kind of let go of any attachment to what we think that place might be for a moment? Just like let that go. And we're going to start to drop into full presence together. So the first thing I'm going to ask everyone to do, we did this last week, but this is going to be a much longer practice, is just to start to like wipe between your eyes so that you can look away from the camera. And stand up with me if your body allows for it, but if it's a no for your body to stand, you can stay seated. And just start to wipe down your arms into your sacrum, into your belly, into your legs. Open and close your jaw a few times. Pedal your feet on the floor if you're standing. Just put a little bend in your knees, a little bend in your hips. And then find a focal point in the room where you can soften your gaze as if you're looking through that focal point. Drop your breath down into your belly. As you breathe in, you feel your belly rise. And as you breathe out, you feel your belly fall. On the next inhalation, raise your eyebrows up to open between your eyes. And as you breathe out, relax your eyebrows back down. Retract your chin a little as if you're giving yourself a double chin to open up in the back of the head. Then pinch your shoulder blades together, palms facing out as if you're pinching a pencil between your shoulder blades. And then tuck your pelvis under, bending your knees, bending your hips to bring your belly button into your spine. A little contraction from the pelvic floor. This might feel awkward for a moment. Notice what your breath is doing. Yes, I'm making you use your body. Drop your breath back down into your belly and just start to let your spine elongate. Now let everything fall heavy around your spine. As you breathe in, your belly rises. As you breathe out, your belly falls. Open through your throat a little and bring your attention to the top of your head. Visualizing the top of your head opening like a flower blooming. As you bring your breath down into your belly, out of your throat, out of your chest, you feel the top of your head opening, opening to all parts of you, past, present, and future. Any parts that have dissociated, have split off. With your breath down in your belly, we gently invite those parts back in. Allow your body to soften and just notice, is there any place in your body responding to this? Are there any sensations, any body pain, any nausea, any dizziness? Don't worry, we're going to move in a moment. On the next inhalation, begin to raise your arms up as if you're collecting clouds, all parts of you coming forward. And as you breathe out, your hands scan down your body, inviting those parts of you to fall into any tender places, the back of your neck, behind your eyes, your legs, your torso. And then you're going to do a slow quarter turn, staying back over your heels, keeping your stomach contracted, open through your throat. Feel the newness of this new direction. Then we're going to begin again. Arms come up nice and slow. Collecting energy, all parts of you. As you breathe out, your hands scan down your body and feel that energy falling into the density of the physical body, into any tight parts, into any blank or neutral parts. And then do another slow quarter turn to face a new direction. Feel the newness of this new direction and begin again. In this practice, we call in all parts of us, releasing any expectation of what this part is or who it is, allowing ourselves just to feel it. Feel those parts returning home, your breath creating that invitation. And go at your own pace to do a final quarter turn. Notice how slow I'm cueing you to go. This is how slow the physical energy moves. It's very dense. Feel as you collect that energy, feel the density as you breathe in and as you breathe out, creating the invitation for more of you to fall in. Feel any parts that may feel like there's a void there, like you're not attending. Breathe into those parts now. Usually it's the back body. And then do a slow quarter turn to face forward again, to face the screen. Now I'm going to guide you through a spinal practice that's going to open the central nervous system, waking up the spine, regulating the ANS, the autonomic nervous system. And this is going to help to start to increase our interoception, our ability to feel what's happening inside of us. Take another slow breath in, raise your eyebrows up. Slow breath out, relax your eyebrows down, wiggle your toes, tuck your pelvis under a little, and then drop your chin to your chest. Then your head's going to start to turtle forward and up. So this spinal flow is designed to wake up the vertebral spine, the central nervous system, and then your head starts to come back, but don't go back too far. Stay within your tolerance level. Then your head's going to come back to neutral. Now we're going to go down again for a second round. Go a little further than you did the first time until you can feel it pull between your shoulder blades. Then your head's going to slowly start to turtle forward again and then up, feeling a balance between where you can let go while still recruiting strength down in your core, out of your neck. Your head's going to come back a little, but stop when you feel stiff. When you feel like you're starting to lose that core control, then that's your cue to stop going back and then start to come forward again. Now your head's going to go down a third round, vertebrae by vertebrae, until you feel it start to pull down into the low back. Where can you let go down there? Put a little bend in your knees. Then your head's going to start to turtle forward and up again. So notice I'm only going about 90 degrees from the floor. Don't go down all the way. You always want to feel control in your core. So this is called a spinal flow movement. It's like a spinal wave. And then when you go back, feel the pulling through the front of your neck, but stop before you feel like you're going to lose control. And we're going to do a fourth one of these. So 4 of them forward and back. Now on this fourth one, this is really your opportunity to pause at places that feel really tweaky and breathe above and below those places. Where can you let go above and below? You'll notice that a lot of this is just holding, and we're sloughing off that surface level tension. When you feel it let go, you can keep going, still only going to about 90 degrees from the floor. So don't flex any more in your hips than about 90 degrees so that you still feel that control from the core. Maybe if some of you have access to the pelvic floor, you can squeeze the pelvic floor a little, stay open through the throat, and come back all the way up. Now we're going to go into lateral flexion. Your ear drops to your shoulder and you're going to feel the pulling on one side of your neck. Then your head's going to come up, open through your face. Stay with your breath. This should be easy. Ear comes to other shoulder. Feel the pulling on the other side of your neck. Head comes up. Where can you let go down the spine? Maybe you can feel this all the way down the spine. Now in the second round, the ear comes to shoulder and you feel it pull all the way into the ribs in the back. And then you come out nice and slow, spinal wave. As you come out, you're contracting from your core here, from your obliques. This is all to give you information, no judgment. And as you go into the other side, ear to other shoulder, it's a balance between where can you recruit strength as you come out of it while letting go on the opposite side. So that's 2. We're going to do 2 more. Left and right is 1 whole round. Ear comes to other shoulder. Now this time as you go in, breathe and connect with where you feel it all the way into the sacrum, low back. And then as you come out of it, it's a balance between where can you let go in your spine. Send your breath there with where you need to recruit in the core. Now ear to other shoulder. Feel it pull all the way down your spine. If you find yourself looking up at me to see if you're doing it right, that's your cue to take a breath and ask, what am I feeling? Good, you all look lovely. As you come up, we're going to do 1 more each side. On this one, pause at places that you feel it catching or pulling. Like I feel really tight in my neck, so I'm going to pause. Breathe above and below where I feel it pull. Where can I let go? And then it lets go a little, and then you can keep going. And then come out. 1 more other side. What is your breath doing? And then your head comes up nice and slow. So these are called spinal waves, and they're designed to wake up the nervous system. We're going to do 1 more, and then we're going to start to take this into a body scan to ask for what feels important in the body. Take a slow breath in, raise your eyebrows up. Slow breath out, relax your eyebrows down, pedal your feet. This one's a little more complicated. We're not going to spend a lot of time figuring it out. Place your hands on the base of your ribs and pretend like you're inside of a hula hoop. You're going to get the base of your ribs to hit the front of the hula hoop, the side of the hula hoop, the back of the hula hoop, and the other side of the hula hoop. This is not easy for most people because we tend to be very stuck in the thorax, in the rib cage. So even if you're not getting any movement at all, just the simple act of trying to disarticulate here is creating a lubrication. It's waking up the middle of the body. Maybe drop your arms down, let your shoulders fall away from your ears, and just start to move from the ribs. If you've ever done belly dancing, this might be easy for you. And it's natural for the head to move a little bit and the pelvis to move a little bit. Stay with the ribs just for now, especially if this is new for you. Pretend like you're at the eye of a tornado and you're just moving like a vortex in the middle. The ribs are rolling under the shoulder blades. The lungs are being massaged and woken up. The respiratory diaphragm, the digestive system is squishing as your body pushes back behind you to the side. Stay with your breath. This might be waking up your low back a little bit. And then you can just start to slowly add your head and your pelvis. As your ribs poke forward, your head and your pelvis go back. As your ribs go back behind you, your head and your pelvis tuck under. Your pelvis is like a bowl rolling on the counter. Your head, please move your head and neck very slowly. A lot of us have a lot of cervical herniations or compression from computer work or just life stressors. We hold a lot of tension in our heads. So remember, it's like you're at the eye of a tornado or a vortex. But what we're also doing is we're starting to wake up that energy. We are more than physical. We have subtle energy bodies that expand all beyond our physical body. Start to reach out your hands as if you're just starting to feel into the energetics in the room. Staying with a little bit of this beautiful vortex-like movement, you can start to pick your feet up off the floor. Wiggle your toes, maybe bend your knees a little. Feel your strength today. Yeah, I'm challenging you to move. And if you're watching this, if you're driving or going somewhere and this looks appealing to you, you can come back and watch the replay later. Just let yourself take it in right now. So use this time to start to stretch the limitations of what body am I working with today. Maybe do a couple lunges, moving from one side to the other. A little squatting to feel what's behind you. There we go. Pick one foot up off the floor to test your balance and hold it there, like move so slow like you're moving through water. And then open your eyes and soften your gaze. Begin to expand your awareness beyond just your physical body. Feel the heat that you've generated. But also remember, in the beginning, we called in all parts of us. We called in our higher level guidance, any parts that might have split off or dissociated. As you're moving, just feel into that energetically. Feel behind you, to the left, to the right, above, below. Do you feel your awareness being pulled somewhere? Notice any thoughts that might come with it. Just breathe into those and go back to the question, what am I feeling? And now begin to scan your own body. Feel for all the tender places. Ooh, we woke something up. Place a hand wherever you might be feeling some tenderness or any pain, any tightness. Breathe into that. Oh, I see you, body. I feel you. Yes, this is familiar. And now I'm going to invite you to start to scan for a place that is not talking. A quiet place, a dormant place, a void space, a space, had you not done this body scan, you would not have identified it. You might need to slow down your movements, but if you feel yourself holding your breath because you're thinking too much, that's a sign to take a breath and drop back into what am I feeling in my body today. We ask for higher level guidance and intuition to start to turn on here. The body speaks in pictures, images, one word sentences, subtle awarenesses that are easy to push away. Whatever the first answer is, I want you to go with it now and ask the question again. What feels important in my body today? And when you find a place like that, put your hands there. Notice any thoughts that are coming up. Maybe in your body there's a guarding sensation happening, a questioning. Oh, this feels familiar. And when you find that place in your body, feel the warmth and the pressure of your hand there. Breathe gratitude into that place. Now we are going to lie down in the place that you designated. Notice my cat came right as soon as I said that. She knows. And if it's in the front of your body, you're going to lie on your back and put your hand there. If it's in the back of your body, like for example, I felt a lot in the back of my ribs, right at the base of my lungs, you're going to take your towel as I showed you, roll it up a couple times, and then roll it into a Tootsie Roll. And then you're going to lie on the towel wherever you felt it. Because this towel is squishy, it's okay to put it on ribs. And you might either have it across your body. If it's along your spine, you can have it upright or horizontal. The only way you'll know which one is the right one is by trying it. Now, if it's a shoulder or something, then you're fine. You can just put it right up in the shoulder. Just watch for your neck and make sure you don't go on too much hyperextension. If it's your sacrum, that's easy. You can just put it across your sacrum and lie on it. If you're not sure, you're welcome to ask. Feel the subtle warmth and pressure behind your back, if it's behind your back. And if it's in front of your body, feel the subtle warmth and pressure of your hands. Allow your hands to just open, applying just enough pressure that you can feel it activate something inside your body. Your heart may be racing, your breath shallow, your face may be tense, your throat may be closed. Scan your body and ask, where can I let go here? And feel as the body begins to settle into the floor, the bed. If you need to keep your knees bent and your feet flat for your back, that's totally okay. Honor your body's needs in this moment. On the next inhalation, raise your eyebrows up. And as you breathe out, relax your eyebrows back down and drop all of your attention into the pressure underneath the towel or your hands. Feel the subtle pressure, the warmth. Feel what your breath is doing. Let your thoughts come up. Take notice of what they are. Breathe into them, let them pass through, and drop back into the pressure, the warmth. Let your breath start to deepen. Go to where you're feeling this in the body, right at the site of the pressure. Get very curious about what's in there, the bones, the ligaments, the nearby organs. When thoughts arise, let them pass through and drop back into what am I feeling? You may begin to feel a subtle sensation off site, away from the site of the pressure. Go to where you're feeling this the most. Maybe there's a little trickle, a fasciculation, or a movement. Go to what you feel. What's in there? What are the organs nearby? Where is it located? When your mind wants to drift away, come back to that subtle sensation, that alchemy that's occurring because your awareness, because the power of the mind is now one with the physical. Feel how it shifts and changes, how it grows. Maybe it spreads, maybe it dissipates. Notice if your mind wants to do something with this information. Thank you, mind. You're so smart. You've gotten us this far. Breathe into that and then drop back into what am I feeling? Wherever you're feeling this in the body, allow that face to move a little, like you're pulling on the thread of a sweater, creating an unraveling. Breathing into where you're feeling this. With your breath and gentle, subtle movement, it begins to unravel deep within, around the bones, the joints, the organs. With your breath, allow it to expand up and down further than you ever thought it could go. Be open to where this may go. Take a few slow breaths. As you breathe in, we invite in a clearing. As we breathe out, we allow those parts that have split to come back into the places that we feel this the most in the body. And then just begin to move those places like a cat stretching. Start to make the movements a little bigger in that area, like you're waking up. Where can you create space with your breath and movement to allow for the energy to really fully fall into the fascia as it releases. And then we're going to slowly start to roll to one side, opening your eyes, scanning around the room, naming in your mind the objects that you're seeing, the colors, the texture, any little imperfections in the room. Feeling what feels different in the body. Again, without judgment, I'm just going to ask you to take a second to take note of where you felt this in the body. And if you'd like to type it in the chat, you're welcome to do so. And you can come back to your seated position. And we'll just take about 5 minutes to talk about this, to process through, to name what you felt, to anchor it into your reality. Again, the body speaks in subtleties, and it's very easy to talk ourselves out of our experience. So we're going to anchor this in now. Just take a moment in the chat to write down where you felt this in the body. It could be exactly at the site of where the towel or your hand was, or it could be that you were surprised that you actually felt it start to refer somewhere the more your mind stayed present. Upper right thigh, upper right glute, so right thigh and glute. Felt it in an injured knee, hard to reach in the lying down position. Jennifer, which knee? Stomach and gut?
No, my knee, like my leg knee,
Yeah, left knee or right knee?
right knee.
Right knee. Lots of right-sided stuff today. Stomach and gut. Okay. If anyone else would like to share, I can interpret, I can decode for you. Would you like me to decode, to speak on behalf of your body?
Sure.
Okay. Jennifer, yours is very interesting. So I will just go ahead and say now, because I often get questions of where can I get more information? How can I follow up on this with you? If the things that I'm saying are of interest to you, I have an article that I wrote through Pathways Magazine that I can actually type into the chat here. So does anybody know Pathways Magazine? In this past issue, I did an article called Why Body-Led Healing, and I introduced the Psychosoma integration model and talked about what's known as the 7 embodiment codes. These 7 codes are what I had observed in the clinic over the course of a decade plus of common places in the body that we tend to store specific traumas and emotions. So if you're interested in reading the article, I'll just type it in the chat, and then they'll add it to the link in the replay. But code number 7 actually talks about the knees. Code number 7 is all about the knees. And in somatics and in my observations, the knees hold emotion and memory related to needing to pivot, because the knee is a hinge joint. Its primary action is just to flex and extend. It's not meant to have torque like a shoulder, like a ball and socket joint. So when we're at a place in our lives where we're really being asked to pivot because maybe the direction we're facing isn't working for us and we're now starting to face a new direction, sometimes we'll feel that stress in our knees. But I don't know if that resonates with you or not, Jennifer, but oftentimes when we're kind of going through a pivot in our lives, our knees will be
Well,
talking.
it definitely resonates. In this case, I have an injury that happened in December in my hip and my knee, and it's not fully sort of figured out yet. But
You bet.
but what was interesting to me about the process was that I wasn't feeling, the knee wasn't bothering me before, and then in the process, it just like it yelled at me.
Exactly. And this is why body-based healing. Right. So another link I'll share with you here is my website. I have a list of the 7 embodiment codes on my website down here as well under phase 1 work. But what was I going to say? Oftentimes those moments in time, those traumas become stuck in the body, and then they just continue to, we tend to pile onto them. So with this work, we're actually committing to creating a sacred, safe, secure container where we can hear those subtleties. And so what you'll find is like, oh, this old injury is actually still here. It's still there. And our coping strategies have allowed us to turn the switch down on that. But the injury is still there. And if left unaddressed, it starts to create compensation patterns in the body that later lead to things like low back pain or what have you, if it's the knees. And eventually it does start to change our behaviors as well. We start to kind of get stuck in some repetitive behavior looping or trauma looping. So oftentimes when people start to work with me, it's because they're catching that some of these things are not really resolving. And then when we start to listen, exactly what you said, Jennifer, will happen is like, oh, a thing that I dealt with a long time ago is talking. It's because it's actually still there and it's being asked to be addressed. I'm getting a lot of stomach and gut. The stomach and the gut is embodiment code 1, rooting into desire and worthiness. The digestive system holds a lot of emotion. It's like a primary sponge for emotion. So when we start to uncover this in the practice that I taught you here, the next step becomes, okay, then what do we do about it? So that's where we then go and connect with that place in the body, allow it to release and express what's in there, and then we can integrate it back into the psyche so that it doesn't stay stuck. A lot of this is about repatterning, which requires repetition. I had mentioned last week, repetition over time will begin to repattern some of these things and they'll integrate back into the psyche. Low back, and then after lying down, felt relief in neck. So the low back and neck has a push-pull interplay, usually related to dysfunction and balance. It's like we're constantly trying to seek balance in our lives. So we'll, weight things more heavily in one direction, and then when that stops working, then we overcompensate and swing into the other direction. And really what we need to do is try to find a way to hold both truths of equal and opposing weight at any given moment. So if you struggle with balance, I often find that my clients have kind of a push-pull interplay between the neck and the low back that plays out. Again, this may or may not be resonating with you, but the reason I'm sharing is because I want you to know that you make sense. Right? Ultimately, you make sense, and the answers that you're seeking are often found in the body, and they are screaming at you. It's just we're usually mostly listening to the loudest ones first, which is pain and dysfunction, and it's not until we learn how to really drop into the subtleties that we can hear the quieter ones. All right, thank you all so much. Let me just add in here too. Here's where you can find more information about the embodiment codes. And I'm going to be offering a free or donation-based webinar on August 25th on grief and the Psyche Soma integration model, how we can use this body-based model to release grief. A lot of us are holding a lot of grief still, and it's mostly grief around the changes that we've been experiencing. So being able to let that go, let that through and integrate it is going to allow us to not brace so much with all of the shifts that are happening politically and otherwise right now. Thank you so much.
Thank you, Niles, so much. Thank you everybody for coming. Stay cool. It's super hot. I think we're gonna have more hot days. And Janet, what do we have next Friday?
Well, we have you, and I'm working on another guest
We'll see you
for
then.
next week. Bye, everyone.
Bye.
Bye.